All right, Dr. Elias is back. Dr. Ellen Elias is a full professor of pediatrics and genetics with tenure at the University of Colorado School of Medicine. Her CV is as long as your arm. She's one of our favorite experts, and let's have her get started. Dr. Ellen Elias.
Thanks very much. Hello again. So I'm going to talk about two of my favorite topics, vaccines and sex. So we're going to, I was telling Dr. Russo and Dr. Porter about the sex part and how I get to talk about that, and I'll explain that in just a little bit. But first, Gretchen asked me to chat about vaccines, and as a pediatrician, I feel quite strongly about the importance of vaccines for all children, no matter who you are and what you got. So let's talk for a few minutes about vaccines. This is the schedule that I put in a slide from the American Academy of Pediatrics, of which I am a member and have been a member forever. I've been a pediatrician now for 45 years, so that's a long time. There is a schedule. This particular schedule goes up from birth to age 6. And as you can see, there are lots and lots of vaccines in here to give to babies and to very young children. There's a brand new one I was just going to highlight for a minute for RSV. Respiratory syncytial virus is a really terrible respiratory illness. It can lead to children being hospitalized in the intensive care unit, and babies, especially little newborns and vulnerable infants, can be sick as stink when they get RSV. In prior years, we had to give a shot every month, which you could get up until you were 2 during the respiratory season to give you some immunity to RSV. And now, thank God, there's a vaccine. It's made a huge difference in the lives of children born prematurely and children with respiratory status that's compromised. You've heard that there can be pulmonary complications in kids with SLO, where the lungs don't form properly, and very often in just a fragile infant, they can have heart disease that leads to some compromised pulmonary function. So the RSV antibody has been a real wonderful addition. And then I think all of you with children are very familiar with the usual vaccines that are given at 2, 4, and 6 months of age during the first year of life. And diphtheria, tetanus, and pertussis is a big one. You get your first 3 doses as an infant. You get a 4th dose sometime between 15 and 18 months. And then you get your last dose when you're in late preschool or starting early elementary school. And then you're nicely protected against those. When you're older, every 10 years, you can get a tetanus booster. Pertussis is still here. And children, pertussis is whooping cough, and that can also cause very, very severe respiratory illness that leads to admission to the ICU sometimes. Hib is the vaccine for Haemophilus influenza. And as a pediatrician who's an old lady now, I saw what Haemophilus infection did to infants and young children. It could cause a horrible infection around the eye called periorbital cellulitis. It could cause mastoiditis. It could, the worst thing it did was cause meningitis, and that could be lethal. We are so, so lucky that we live in an age that we can protect children against Haemophilus influenza, which is a horrible, horrible bacterial infection. Pneumococcus is a kind of bacteria that also causes severe respiratory illness, and severe pneumonia can also cause meningitis. Polio, we are so fortunate that we rarely see polio anymore. It's been mostly eradicated, but people with polio who are, adults my age who were born before there was polio vaccine can have lifelong disabilities from that. Yitzhak Perlman, one of the most famous violinists, had polio as a child, and now when he performs, he used to be able to come out on stage with crutches. Now he has to come out in a wheelchair because of the impact of polio on his ability to ambulate. So those are all vaccines, illnesses, some viral, some bacterial, that we can immunize against and prevent these truly, truly horrible and sometimes lethal disorders. COVID is the newest one in the lower part of this list. You can start vaccinating as young as 6 months, and then the COVID vaccines have been new and improved and have adapted to the new variants of this virus that have come down the pike, and COVID can also be a very severe illness at any age. Especially since it happens to come around often at the same time as influenza. And some kids can get both viruses simultaneously. There is not one combined vaccine. They're separate vaccines, but the flu vaccine is another one you can give as early as 6 months, and then it's once a year. The flu vaccine is also modified, not as often as the COVID one has had to be, but flu strains do change and evolve over time. That's why there are new strains that can come out. And back in 2008 was this big epidemic of bird flu. We had 12 pediatric deaths from that version of influenza, and half of those were in my complex patients, complex and fragile children who came and were followed in my clinic for children with medical complexity. So clearly, children who are fragile and complicated are more susceptible to these diseases, and it really helps enormously to vaccinate and protect not just the children, but their parents too, because if you get sick as an adult, then what kind of caregiver can you be for your complex and fragile child? So we give both, we vaccinate parents in my clinic too, so that they can be safe and take care of their children. I wanted to spend a minute and talk about the MMR vaccine. This is the vaccine that back many years ago there was a terrible man in England who claimed that the MMR vaccine caused autism. His research was flawed and fabricated and fraudulent, and the article was eventually pulled, and people really understood in the medical world that this is not true. The MMR vaccine is not associated with autism, but you have no idea what that did to the health of children all over the world, that parents stopped vaccinating their children for the fear that their child might develop autism. The MMR vaccine was typically given early in the second year of life, and that's the age that parents realized, hey, my kid should be talking and communicating and interacting, and they're not. And he just got that vaccine a couple of months ago. That must be the cause. And it was that temporal relationship between getting that vaccine and appreciating the fact that something was wrong and it turned out to be autism that caused that belief. It has been disproven many, many, many times. by good scientific papers. But I remember back in the day, I was giving a lecture to the American Academy of Pediatrics group at their big annual meeting. The topic of my lecture was the genetic causes of autism. That's one of my specialties. And there were death threats because people felt that as a pediatrician, I was getting rich by giving my patients vaccines and causing their autism. Didn't want to hear that there were genetic underlying causes of autism. So when I gave that talk, they had to move it to a different venue that they made private only for people who were attending that conference. And I had to have an altered name tag so nobody knew who I was, so I would be safe, and a police escort. I'm not kidding. This really, truly happened. And there was a lovely, lovely infectious disease expert at my hospital who had written one of the papers that disproved the association between MMR vaccine and autism. She received death threats. She had just had a baby. They had to actually move and have an unpublished phone number to protect her safety, because people who believe that vaccines cause autism can practice violence and be very virulent, angry individuals. This is the world we live in, folks. There is no connection between MMR vaccine and autism. Chickenpox it's not generally a lethal disease unless you have cancer and you're immunocompromised for some other reason. And we very often give the MMR and the varicella vaccine together. They can be given as one shot together, and then you get a second dose at around the same time you get boosted with your DTaP. One of the questions that I have often gotten over time is it safe to give so many vaccines all at the same time? And the answer to that is yes, it's completely safe. These have been studied very, very carefully by the CDC. Unfortunately, all those experts on the vaccine committee were fired recently, and that committee was disbanded and replaced by people who don't believe in vaccines, who are not MDs and not pediatricians. So be careful what you read going forward about vaccines. It may not be based on science. And then the last vaccine, the hepatitis A is not a mandatory vaccine, but we do give it to people who live in endemic areas or are going to travel to endemic areas where there's lots of hepatitis A. Mexico, some of the southwestern regions of the U.S. So you need two of those shots separated by 6 months. You could basically get them at any age. We usually give the first one at about a year. But, I work in practice in Colorado, and a lot of my patients go back and forth to their families in Mexico. Not now, but yeah, we do give Hep A to some families depending on a need. So this is the vaccine schedule from the American Academy of Pediatrics for older children going up to age 18. And again, there's influenza every year and COVID when they've come up with a new version of it. And then sometime after age 10, you can get your tetanus booster. And I wanted to spend a minute, and I'll talk about it again in my following talk, about the HPV vaccine. HPV, human papillomavirus, it stands for, is a sexually transmitted disorder. The disease itself is not very severe. You might not even know you are sick if you get an HPV vaccine illness. But the bad thing about HPV is that that virus causes cancer. Horrific, terrible, horrible, difficult to treat cancer. You can get cancer orally in your oropharynx. You can get cancer in your genitals, or you can get cancer in your rectum. Any place that you can think of where you might have sexual activity. We used to give HPV closer to leaving for college, but the age was moved up because we realized that people are practicing sex younger and younger these days. So now we usually give HPV starting around age 10 and in early pre-adolescent years, just to make sure that people are covered. I will talk a little bit more about the importance of this vaccine in people with disabilities in my next talk. But trust me, those types of cancers, and I have seen it, are horrific. I'm married to a cancer specialist, so I've seen some really yucky pictures. And then I wanted to spend a minute talking about meningitis. Meningitis is one of the most severe infectious diseases that we can see in human beings because it starts acutely and you can be dead within 24 hours or less from meningitis. There are two forms of meningitis, A and B. So Menveo and Bexsero are the names of those infections. They're two different shots. And you should make sure if you have kids in the ages between 10 and 20 that they get both forms of meningitis protection, A and B, because they're both truly, truly terrible diseases. You don't want your children to ever get that. Highly contagious. Dengue fever is a disease that we don't really see in the US, but some people do travel, and there is a vaccine that can protect against dengue fever if needed, if the family is traveling to that area, mostly in Africa. All right. So why are vaccines important, particularly if you have a child with Smith-Lemli-Opitz? Well, they can protect children, and they're very, very effective against diseases that are preventable. And when you have these diseases, it's possible that they could be lethal, but definitely they can lead to discomfort and illness. I have seen measles. I have seen patients with measles from early on in my training and practice, and it's a horrible, horrible disease. We are now seeing measles all over the country, started in places where populations did not vaccinate their children. And it used to be that even if a very tiny percentage of the population did not vaccinate their children, there was this herd immunity where enough people had vaccinated that it protected everybody. We're losing that herd immunity by so many people deciding not to vaccinate. So there are many, many more people in our country who are not vaccinated and protected against measles because that was the vaccine that everybody avoided, worrying about the autism risk, okay? So that's the reason why we've seen so many cases of measles that have sprung up in Colorado. There was a traveler who came in on a Turkish Airlines flight to Denver International Airport who had measles. He basically infected many people on that airplane, and then he stayed in a hotel and went to local restaurants and managed to give measles to almost 24 people now in Colorado. And it's everywhere, all over the country now because it's so incredibly contagious. Now, patients with Smith-Lemli-Opitz are medically fragile children, right? They might not have the best nutritional status. They can have anomalies that lead to more significant respiratory disease when they do get ill. The GI tract can be very fragile, and so patients, if they can get a bad viral infection and get sick from that. And then patients who have illness that's associated with high fever may not be able to mount stress response from their adrenal glands to make enough cortisol to cover for a severe illness. So is it safe to give all these multiple vaccines? Absolutely. Vaccines can be given together at the same time per the schedule I just showed you. Many vaccines are designed as combo vaccines so that you don't have to give 4 shots, but you can get 1 shot that covers for 4 diseases at the same time. And there's good literature now to say that if parents elect to choose a different vaccine schedule because they only want to give 1 vaccine at a time, that there are a lot of families that just don't go back and get the rest. And so that leads to children who are not protected and not vaccinated. And the schedule that I just showed you is based on science. It's based on when children are most susceptible to certain diseases, and that's why you give some diseases very early on during infancy when you're most likely to get Haemophilus, or you're most likely, to get whooping cough, and that's when you need the protection the most. So that's how this vaccine schedule came about, based on science and studies that tried to figure out how can we protect our children the most. So it's safe to do this, and that's why it's recommended in this way. Do vaccines cause autism? 5 explanation points. No, they do not. Has been completely disproven, and many of your kids might have autism anyway because of the association with Smith-Lemli-Opitz, so vaccines are not going to make that worse. They're not going to make that worse. So measles, I already talked about. There is a lot of information that goes around on the internet that is not correct. Be careful and don't believe everything you read online. There's lots of conspiracy theories out there about what you can do to cure your measles. Vitamins don't do that. They don't cure measles. Vitamin A does not cure measles. And this is a disease that is preventable, completely preventable, by a very effective vaccine. I have seen measles encephalitis. So that's when measles infects the brain, and it can cause death or very severe neurologic consequences. And measles virus also goes right for your immune system and can cause severe disruption of the immune system and your child's ability to respond to other viruses in the future. So measles is bad. It's a horrible disease, horrible disease. And you want to prevent your child from getting that sick. So please, trust science. Trust people who understand and have looked at this information. Don't trust conspiracy theories, and vaccinate your children. That was my last slide on vaccines. Are there any questions about vaccines? Before I move on and want to talk about sex.
Here's a question.
I apologize, I came in late. The HPV vaccination, is that recommended or not recommended for?
It's recommended, and I'm going to talk more about it in this coming talk too.
All right.
Okay.
Thank you.
So hang tight, and if I don't answer all your questions about HPV, ask me again.
Any other questions? Thank you, Dr. Elias.